Okay.
Because sometimes it takes a moment. I just want to make sure that I have enough time because everything is timed just so. Uh, so are you going out today or coming to Jonesboro today?
No, actually today I'm working from home. So
Oh, okay.
Mhm. If we if we aren't teaching or have clinic, then we've all basically been working from home just to try to be safer here lately.
Now, how has it been working for the students who are like having to do, I guess, lab that are
Yeah.
those
So
hands-on things?
yeah, we still have been doing our classes. We the students are broken up into smaller groups, and the groups don't mix with each other. And then everybody's wearing their masks, and the faculty, we wear full PPE for those labs where we're really like up close with the students. So we're trying to be, as careful as possible. And I think things are working really well, and hopefully they'll continue to work so well.
Okay. Please let this work. Okay, so I just set up the Facebook Live.
Okay.
And it says we're live. So good morning to everyone. Welcome to KLEK Community Conversations. I'm your host, Kabila Jones. We'll be going live on air in just a moment. My special guest today is Dr. Christine Hartford. So that, yes, I'm sure I said that right. MD. She is a professor, or was a professor at NYIT?
Assistant professor.
Assistant professor. And so today we're going to be talking about children and COVID, and we're going to go through various topics in relation to that, and maybe what parents should look out for, measures to take. If you have any questions, comments, drop them in our Facebook Live feed. We'll get to them as time allows. And I hope if we have more questions, then time allows, Dr. Christine, when you go back through the live feed and possibly try to answer some questions or address some comments
Sure.
when we get done.
Okay.
And so this will be on the KLEK Facebook page. So whenever you have time to go back through and look at some of those questions.
Oh yeah, absolutely.
Because sometimes we do, especially for topics like this, we have way more than we can actually get to. And I just want to apologize in advance. We're going to do the best that we can because I know a lot of people have a lot of questions. And we're seeing the reports come out every day, and the numbers are either going up, they're either plateauing or they're going up, or they're doing something. And so I know that's concerning for a lot of people, even myself.
Mhm.
Um, I've been personally trying to self-isolate and just limit my exposure to anybody.
That's
But I
smart.
mean, you just never know.
Absolutely.
I still get deliveries, so you just never know.
Mhm. Mhm. Yeah, I think one of the things about this virus is that we can feel absolutely fine and have no symptoms and still be infected with it and still be transmitting it to somebody else. So I think it's absolutely the right thing to do to be as careful as you possibly can.
Okay. So we have a few moments before we go live on air. We have the weather, the news, then some legal stuff. And so I'll, if in the middle of you talking, if you see me throw my hand up, that means we're getting closer to a break.
Okay.
So, because I don't want to have to be like, just cut
Okay.
you completely
Okay.
off.
Okay.
Um, it's easier in the studio because there are two monitors. So the guests will be able to see the monitor and see the time as well. But
Oh,
we have to work in a different time, in a different space now.
okay.
So go ahead and pull up. Cool. Make sure to turn my phone
Yeah.
off.
Me too.
I'm ready. I got about 34 go live, and I had accidentally hit the on air button. And just like I'm talking. Okay, I'll be very careful. Oh goodness. Okay, man, this. Oh well, that's what it is. All right, are you ready?
Yeah. You're breaking up a little, hopefully.
Good morning, everyone. Welcome to Community Conversations on KLEK 102.5 FM. And hello to our listeners and viewers on Facebook live feed. I'm your host, Cordelia Jones, and my special guest is Dr. Christine Hartford. She is an assistant professor at Arkansas State University's NYIT College of Osteopathic Medicine. Did I get that right?
You did.
Oh, my goodness. I want to give you just a little bit of background about Dr. Christine. Um, let's see. She grew up in Chicago, Illinois. She received her undergraduate degree from the University of Chicago and her medical degree from the University of Illinois at Chicago. After medical school, she completed a residency in pediatrics at Brown University's Hasbro Children's Hospital. She pursued subspecialty training in pediatric hematology oncology at St. Jude Children's Research Hospital and practiced this specialty for several years before refocusing her career on general pediatrics. So welcome, 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 Dr. Christine.
Thank you for having me.
All right, so today our topic is going to be all about, well, not just all about, but majority of it. And so let's get into what are the facts, the figures, and some of the myths.
Okay, there's so much we could talk about. I think as far as some of the facts and figures, the most important thing for everyone to realize is how quickly and how much the virus is increasing in just the last several weeks. Yesterday, there were over 150,000 cases in the United States. And when I looked at the charts yesterday morning, we had reached almost 2,000 cases just in the state of Arkansas. So the numbers are going up when you look at the graphs almost in a straight line. So that's really concerning. Our hospitals are going to start to be really stressed because of this. So it's really concerning. And this is the time where we need to, it's hard because it seems like this has been going on for such a long time, but we need to be as careful as we can and wear our masks and social distance to do everything that we possibly can to try to help keep ourselves safe and healthy and try to help stop the spread of the virus.
Okay, I want to go into masks because that seems to be one of the number one topics people discuss. But I want to, before we get into that, I want to make this statement. Most of us that are living now, have never gone through anything like this. A lot of researchers and commentators relate this to the 1919, was it 1919? The
It was
Spanish flu. Okay, and so most of us were not around during that time, so we don't know what the conditions were like and how long the people had to endure. But do you all as doctors study that time period and what was done, what wasn't done, and then try to see, okay, how can we make it through COVID?
Well, that's a really good question. I actually don't know too much about that pandemic. So I have
Okay,
not personally studied it. So I don't, I'm sorry, I don't know the answer to that question.
okay, okay. I'm sorry to throw that out there.
No,
I'm,
that's
I'm
okay.
just,
It's a great
I'm
question.
just, okay, let's go ahead and go into masks because
Okay.
this seems to cause so much
Yes.
upset, to
Yes.
say the least.
Yes.
So please talk about that. So
Sorry,
their efficiency, do they work?
sorry, you were breaking up for
Am I
just,
breaking up?
you were breaking up for just a second. What was this? Did you have something specific you were asking about masks?
Well, well, basically, tell us about their efficiency, why they're important, because a lot of people just are upset about having to wear them.
Mm-hmm. So I think um, the way this virus mostly spreads is through what we call droplets. So that means when we cough and we sneeze, which is very obvious, but even when we talk and when we breathe, we are expelling droplets from our nose and from our mouth. And those droplets have the virus in them. And so that's the main way that the virus spreads from one person to another. And so by putting the mask over your face, those droplets, many fewer of those droplets will actually get out from your nose and your mouth. And so there's less of a chance of that virus getting from an infected person to a healthy person.
Okay.
That's how they work. They also, though the CDC did clarify earlier this week that the wearer is, it also provides some protection to you. So I think, we've been hearing a lot since the beginning of the pandemic, wear your mask, it's to protect other people. And that's absolutely true, because if you're wearing your mask, that virus is not going to get out, but it also protects you. And so I want people to realize that if you're wearing your mask and you're covering your nose and you're covering your mouth, if you're around somebody and that virus is there, having something over your nose and mouth, which is the way the virus is going to get into your body as well, that's going to provide you some protection. So that's how they work. And
Okay. Let's talk about the carbon dioxide concern that people have that I'm breathing in my own, we're supposed to be expelling it, but if the mask is on, it's keeping all of it, right here. So
yeah,
let's,
that's a myth. I'm glad you mentioned that. The masks do not cause hypoxia, meaning low oxygen levels. The masks do not cause you to retain carbon dioxide. While they're preventing those droplets from getting out, you can still breathe in and out. It's not 100%. And if you think about just healthcare workers in general, we wear masks for hours and hours and hours on end, all the time. When a surgeon's in an operating room doing a surgery for 12 hours, they're
yes.
perfectly fine. I've actually seen studies where they've had individuals wearing a mask, and this one was looking at oxygen levels, but they measured, where you put the little thing on your finger and it
Hmm.
measures your oxygen with the mask, before a mask, with the mask on, with the mask on for several minutes, there's no change. So it's a really important message for people to realize that the masks are safe and they're not going to cause those types of problems.
Okay. Now, I know that some people have the medical grade, well, if that's the right term,
Mhm.
the medical grade mask. Some people are just wearing, you know, something similar to a t-shirt material or, the various cloths. So does it matter the fabric?
It can. I think any mask is better than no mask
Okay.
whatsoever. Um, you want something that's a little bit thicker. So ideally 3 layers, 2 or 3 layers. That's a little bit tightly woven. So if you think about it, that those droplets will be less likely to get through if it's more than one layer. So any mask is better than none, but you want something that's 3 layers ideally, or like a surgical mask.
Okay. So let's talk about this in relation to children.
Uh-huh.
What age should they start wearing masks? Um, what age have you seen or in the studies that show they're getting infected or affected?
Mhm. Yeah, so anyone over the age of 2 should be wearing a mask.
Okay.
Um, so, and I think I've seen lots of little kids do it. I think there was a lot of worry that kids would not be able to wear their masks, but I don't think we give kids enough credit. I actually wasn't really worried about that. I knew that kids could do it. If we just model for them good behavior, most kids will be able to do it. It might take some time and they might need to get used to it, but they can do it. As far as who's getting infected, so yeah, children absolutely can be infected by the virus that causes COVID-19. This has been a really active area of study. One thing that people should realize is we've been living with this virus for less than 1 year, so we're
Hmm.
still learning. And so, especially in the earlier months, I mean, there's new scientific data coming out every day, but I think the question about how often children are infected is something that we've learned about over the last several months. Absolutely, children can be infected. We've seen all ages. So
Okay.
there have been, as of a couple weeks ago, about 927,000 cases of COVID infection reported in children, and the ages are across the spectrum. So infants have been diagnosed with COVID all the way up through, all our teenagers and adolescents. There's some data to suggest that younger children possibly are less affected than older children and adults, but I still think that we're still learning about this. And when we say younger, it's the under 10 and younger for sure. Once we start to get into our older kids and our adolescents, they seem to be behaving just more similarly to adults. Uh,
Okay.
so there may be some age-related differences, but I think the important thing to know is that all children are at risk, and any child could potentially be infected.
Okay. So another talking point is the more protective measures we can adhere to, the more protected we will be. So can you please talk a little bit more about that? In the beginning, there was the wash your hands, wipe down surfaces. And so can you go into, now that we are further into this, what other, if there are other protective measures that we need to be taking aside from the mask?
Yeah, that's a great question. And there are several things at our disposal, and none of them are 100%, right? Nothing is going to protect us 100% from the virus. But once you are adding these different things on top of each other, they can have an additive effect and they can help protect you more. So if you
Okay.
wear your mask and you social distance 6 feet, try to avoid crowded indoor places where the virus can spread more. Wash your hands or use hand sanitizer diligently so that if you get your hand virus on your hands, you're not infecting yourself. And then cleaning and disinfecting various surfaces. Each one of these measures can have an effect, and when you add them all together, you're going to be much more protected than if you just wore a mask and didn't do any of the others.
Okay. Now
Yeah.
we see people are still, attending certain functions, and people are still flying and traveling within the US mainly, of course, because we can't go anywhere
Yeah.
else. I have seen people go to like Mexico, but what are your recommendations or suggestions rather in those situations?
Yeah, we need to be really careful. And this is something I've been thinking a lot about as like Thanksgiving's right around the corner. And this is the time of year where we usually are getting together with our family and traveling. And I think this is the year we need to consider not doing that. There have been lots of cases. I think we all have heard a lot about avoiding crowds, but
Mhm.
even, even smaller family gatherings with 20 people or so, once you start getting individuals from different households together, there is a risk to spread the infection. And so even smaller family gatherings have been shown to be the source of outbreaks of COVID. So, the my advice would be to not have your big family gatherings this year. I think we need to be really careful. I think, um, especially if there's elderly people in your family, or anybody else who's, known to be at higher risk of doing poorly if they were to be infected. I know we would all feel like it wasn't worth it if we had our family gathering and then someone got sick. I will
Yes,
say that
ma'am.
that's going to be a personal decision for every family, and it's something that probably should think about now and figure out how you're going to handle it. And if you do decide to still have your family gathering, then think about all the measures that you can put in place to make it as safe as possible. So if you could be outdoors, everybody should be wearing their mask, try to stay distant, wash your hand, all the things we just talked about. Try to sort of put those in place. But this is the year to maybe not have your family gathering. Do something like
Yeah.
we're doing now, and that's what I'm going to do with my parents who are up in Illinois, and we're just going to Zoom on Thanksgiving and make the best of it.
Yeah, I think the frustration comes from we haven't been in a place like this before, and people are just, I don't know, they're just fatigued
Yeah.
and they're frustrated. They just want to break out, and unfortunately, we need to follow some measures
Yeah.
so that we can get this under control and get back to some. I don't like to use the word normal because normal looks different for everybody,
That's
but
right. Yeah.
some type of resemblance of our previous life, of whatever that looked like for you.
Yeah.
But maybe we don't need to go all the way back. I don't know.
Yeah, I think we're learning a lot from the pandemic and the way we're living now, and I do think some things are going to change for good.
Yes, ma'am. All right. So another talking point I want to bring up is the role of children in the spread of the virus. Um, So I'm know that it's something that doctors, researchers are continuing to learn about that. So we only have about 5 minutes left in this segment. So as much as you can get into, if we have to pick it up on the other side of the break, we will. What role do children play? How quickly is the virus spread? We know that many children are in school settings right now. So and a lot of children were still in daycare, even in the beginning of this. Like the little ones were still in daycare in preschool. So can you touch on that?
Yeah, yeah, and you're right. This is something we're definitely still learning about. Um, Children can spread the infection. There's no question about that. Um, there is some data to suggest that they may be less good at transmitting the virus, that the younger children may be less effective in it's spreading it from one person to the other compared to adults, but that's we're still learning about that, and it's not absolute. I've certainly read reports of even just an 8-month-old infant infecting her parents. But as a whole, we think it seems that the younger children may be less effective in spreading it compared to the older children and adults. But again, once you get into your adolescence, those children seem to be acting more like adults. I think overall, schools and daycares that have done a really, really good job in keeping kids as safe as possible. I think um, the reports that I've seen of outbreaks related to schools tend to be in those cases where there was a lot of crowding and the masks weren't being worn. So, you know, we know that the virus is in our communities, and we know the virus is going up in our community. So of course our children are going to be exposed. Of course our children are going to potentially get infected with it, and then they're going to be in school. So if the mask wearing and the social distancing and the hand hygiene is not in place in the school, that's going to be a problem. But when all those measures are in place, and the schools, have the resources to keep these measures in place, most schools are doing a great job of keeping our children safe. But as the virus increases in the community, of course, I think more children are going to be infected as well.
Okay. Wow. It's just, I know everyone, I'm sure, has a lot of concerns, questions. this is a scary time, and no one wants to think about one the virus, but two contracting it and spreading it, especially when they're asymptomatic. I think that's the most, I don't know, I don't want to say scariest, but when people are asymptomatic, you just don't know.
Right.
It's like, who can I be around? Who could I engage with? And we see that a lot of the football games,
Yeah.
other sports activities have been canceled. A lot of children are frustrated. A lot of plays and just a lot of activities have been completely shut down simply because of the virus.
Yeah. Yeah. I mean, this is hard on our kids. They're missing out on a lot of important milestones and activities. Um, so that sort of points to, we talked about how our children tend to do fairly well when they get
Mhm.
infected, better than adults do, which is great. I'm so thankful for that. But I think there's so many other ways that our children are being affected by the pandemic. And that's one of them. Just their emotional health, their education, their socialization, because of like what you just pointed out, things that they just can't participate in right now because of the pandemic.
All right, so we're going to get ready to go to a break here, but I
Okay.
want to continue the conversation a little bit before I get into the next talking points, because I do have a few more questions about children. If there's any parents that are listening, if you want to jump on our Facebook Live feed, you can join us. I won't get too deep because I don't want you to miss the rest of the conversation, but I do have a few more questions, so stay tuned. We'll be right back after these announcements. Okay, so we're off air. We're off air, but I did want to go back to you mentioned how children are now facing some emotional distress, due to their life being turned upside down. Um, have you had a chance to talk to any therapists or counselors um, to see if one, this would be a great time for children to now get into some kind of therapy program, or do we need to start looking out for our children more on that level?
Absolutely. I haven't spoken to any counselors personally, but this definitely is something that our parents should be thinking about and paying attention to. Um, so I think that if there are parents that are concerned about their children, um, connecting with your pediatrician is a good first place to start, so that they can help families find those resources that they might need.
Okay. Whew. And I don't know. Like I said earlier, I've been self-isolating, and I mean, just thinking about the people that do have to get out and take their children here and there, and their elderly family members, and I am just very apprehensive about going anywhere and being around too many people.
Oh,
Because I have a health condition myself, and so
I
I
think
just really try to be mindful.
yeah, no, I think that is the smart way to be right now. Anybody that you come in contact with could potentially be infected. So to be careful, to avoid crowds, to always wear your mask, to only go out when you need to, I think that is a smart way to approach this right now.
Oh my goodness. So, going back to the mask a little bit, we see all these advertisements that people are making masks. In the beginning, I remember some people putting some type of filter in between the fabric. But then there's some masks that are just, like I said, they're almost like that t-shirt
Yeah.
kind of material. What do you suggest with those?
Yeah, so like we mentioned earlier, a single layer is not going to be as effective as a double layer, and three would be ideal. So the masks that where it's often like two layers of material with a filter in between, like that's adding another layer of protection, and
Okay.
that can be helpful. So
Okay.
fewer of those droplets will be able to pass through the mask, and they could be more protective potentially.
Okay. Now, do you have any advice? We have about 30 seconds before we go back on air, but any advice for people who
Sorry, you broke up
Um,
there for a second.
moisturize more. Okay, can you hear me?
No, I can, but I did not hear your question. I'm sorry.
Okay, I'll say that we're about to go back on air.
Okay.
Sorry. Okay, welcome back to Community Conversations on KLEK 102.5 FM. My special guest today is Dr. Christine Hartford from the NYIT College of Osteopathic Medicine on the campus of Arkansas State University. And we have been talking about children and COVID, some of the ways that, not ways, some of the ways to prevent the spread and trying to address some of the concerns that parents, educators, the community as a whole may have. And so we're going to continue our conversation. Um, we talked a little bit off air. We went into more about masks and children. So if your child is exhibiting some type of emotional distress, please try to get them in to see a counselor, a therapist, or somebody so they can have a chance to express their feelings. Children have feelings too, and we need to allow them that space to express themselves because the things that we're dealing with as adults, they're dealing with too as children.
Absolutely.
Would you like to expound on that, Dr. Christine?
Yeah, I agree with that 100%.
Okay.
Um, sorry.
No, go ahead.
Oh, well, I just wanted to mention, kids when they're struggling, whether it's anxiety, depression, frustration, anger, um, they can show those feelings similarly to us, but sometimes they might demonstrate that differently. So I'm just gonna sort of remind parents to, if they notice any kind of behavior changes in their children, like some children um, might be overly clingy or have some separation anxiety where that isn't something they typically did before. Some children do attention seeking behavior. Some children just start to act more defiant. Those could be signs that they're struggling. Some children have problems, focusing or paying attention. Some children you might notice changes in their sleeping patterns or their appetite. Just lots of different ways that children can manifest when they're struggling emotionally that parents can be on the lookout for. And I would just say, if there's, parents know their kids better than anybody, and if your child just something is off and they're just acting differently than they normally did, it's worth thinking about and exploring, could this be the way that they're really just showing that they're having a hard time with everything else that's going on?
Okay. All right. So parents, caregivers, teachers, whoever, please pay attention to children and allow them the space they need to express what they're experiencing. I want to get into another talking point, which is being asymptomatic and how that contributes to the spread of the virus, and how some people are not taking precautions because they say, well, I feel fine,
Mhm.
nothing's wrong, or maybe the symptoms look like something else, like sinus or allergy issues or the common cold.
Yeah, those are both very good points. So there's a significant percentage of individuals who are infected with COVID who never have symptoms, and that's what we call an asymptomatic infection. And you know, those numbers are, I've seen different numbers in different studies. I've seen up to 40% of children may be asymptomatic when they're infected. So whatever the final number is, once we study this pandemic through its completion, it's significant. And not only that, so you can spread the virus when you're asymptomatic. And even if you're somebody who will have symptoms, you can start spreading that infection, that virus, about 48 hours before those symptoms start. So you're absolutely right. You could absolutely feel fine, but be putting other people at risk. And the symptoms, you're absolutely right. The symptoms of COVID, which run the spectrum from no symptoms to very mild, just runny nose cough, to severe, respiratory failure and, needing to be mechanically ventilated. They run the entire spectrum, but many of them are what we say non-specific, runny nose, cough, sneezing, maybe a little headache. We see that with lots of different things, right? So
Oh,
it's
wow.
really tough. It's really tough to know just by symptoms alone if something is COVID or not. The one symptom that's a little different, the loss of taste and smell, you might have heard about that. Um,
Hmm.
that's a little more, I would say, specific for COVID, although not absolute. But the rest of them, they look like influenza, which is right around the corner, or just a cold. So it is really hard to tell just by symptoms alone.
Wow. And because of all of these factors, has research been has does the research predict that possibly over half of the citizens, just like globally, will have contracted COVID and not know it?
I don't know the final number of how many of us will be asymptomatic. Um, I haven't seen projections on that, but I think for we should remember in our day-to-day lives is just it's a significant number of people. And so if we take the approach as you were mentioning to me of just being really careful all the time, I think that's the way to go.
Okay. All right, everybody, please just take the necessary precautions. I know we are in a different time and space right now, but we just need to do what we need to do in order to remain healthy as possible
Yeah.
and protect everyone else around us. Let's talk about, okay, I know I'm skipping ahead, but we see that restaurants are still open and certain places are open, shopping centers, and um I know this is something people don't want to hear. They don't want to hear a shutdown. But again, based on research and discussion with other professionals, do you feel that some type of shutdown? And I know people are going to say, "Oh, the economy." I understand. Look, I'm in a situation where I need income too. So, but with some type of shutdown, even if it was for a week or 2 weeks, just nobody move, just be still. Like, I don't know.
Well, I think in general, the less that we're interacting with other people, the safer we're going to be, right? The less people who are out and about getting in contact with other people and potentially spreading the virus, that it will be harder for that virus to continue to spread. Um, so I mean, yeah, there's so much that goes into that from the economic side of things, which is totally outside of my uh, where my brain goes. But I think that the less we're interacting and mixing, the safer we're going to be, and the less the virus would be spreading.
Mm. Alrighty. So I'm going to go into another talking point. If you develop symptoms consistent with COVID-19 or identified as a direct close contact, okay, of someone with COVID-19, you should be
Mhm.
tested.
That's right. Sorry, you broke up there for a second.
So expect that symptoms consistent with COVID or you've been around someone, you should get tested.
Yes, absolutely. Um, so sorry, am I breaking up?
No, I can hear you.
Okay. Yeah.
You're
So
fine.
okay. Anytime you have any of those symptoms we just talked about, that runny nose, cough, congestion, fever, um, that could potentially be COVID, you should get tested. And anytime you're a direct contact, which means you've been within 6 feet of someone who has COVID so you've been within 6 feet for 15 minutes, that's the definition of being a direct contact, then you should get tested. You want to know if you have the infection. And as soon as you meet either one of those criteria, as soon as you're in the situation where you should need to get tested, you should automatically start to isolate yourself and not be around other people until you get that test and until you get your test results. I've definitely seen people who go and get their test and then they don't quarantine in the meantime. And if you have the virus, you could potentially be spreading it around. So definitely get tested and make sure that you isolate yourself until you have those test results.
Wow. Okay. And I know that's another hard part for people because again they go, I feel fine.
Yeah.
Everyone around me feels fine. And see, yeah. I know we can't fuss and control adults too much. However, I just want people to take this serious. This is serious. Um, Let me ask you this. Do you feel that people are not taking it as serious now because we're not seeing those images from hospitals that we saw in the very beginning where people were lined up or hospitals were overflowing with patients and people were dying and the reports were just coming back to back to back? We're not seeing it at that level right now. So do you think people are kind of not taking it as serious as we were in the very beginning?
I think that's possible. I think those images back from New York in the spring were really scary, and that probably did scare people enough to help them sort of adhere to the guidelines a little better. And then, this has been dragging on for several months, and people are tired. But those images that you just talked about, I mean, they're starting to come again. Like I've seen them on the news in just the last couple of days. Other areas of the city of the country that are heading towards that situation. And when you see the way the cases are increasing, yeah, it's very concerning that many areas of the country will be in that situation if we don't, do what we need to do to stop the virus from spreading. So,
Okay,
I
people. I
mean,
mean,
if that helps people to if that helps people to kind of isolate and wear their masks and things, I think that we're going to be seeing more of those images again on the news here before too long, just based on the numbers and the way that they're increasing so quickly.
okay, people. We just gotta take the necessary precautions. I mean, look out for yourself, your family, and your friends, and whoever else around you. We just have to.
We do.
Please, everybody, just take the necessary precautions. Okay. Let's see. So there are so many examples of small family gatherings being the cause of COVID-19, um, the outbreak. And so you touched on earlier about the family gatherings. Thanksgiving is coming up,
Mhm.
Christmas is coming up, and then birthdays and all these different things are happening. So let's kind of go into that just a little bit more about keeping in mind about being cautious.
Yeah. I think everybody should think about Thanksgiving and the other holidays that are coming up and how their family can best handle that and come up with a plan and discuss it with each other and make that decision together, but really think hard about whether or not this is the year that you want to have those family gatherings, because we just need to be really careful.
Let me ask you this. So take a situation where, just say it's sometimes and everybody has on their mask, so there's no eating and drinking, so there's no removal of the mask. Would that still be considered a risky situation, being in close quarters with our masked up?
Sorry, you were breaking up a little, but did you say people
Oh,
inside
okay.
together?
So you're at a gathering like a speech or something of that nature. There's no food or drink, so you're not removing your mask,
Mhm,
but you're still in fairly close quarters.
mhm.
Is that still an unsafe? What are your recommendations on that?
Yeah, that would still be unsafe if it's close indoor quarters. That's not where you want to be. And so that you raise a good point that I want to make. And we sort of got on it a little bit earlier. we need to do more than just wear a mask. We need to wear our masks, but wearing your mask is not a substitute for social distancing, and all those other things we mentioned. So
Okay.
you're safer with your mask on than without, absolutely. But if you're indoors and in close quarters, that's still risky. You'd still be a direct contact of somebody who had COVID if they were in that room with you, even if you're wearing your mask.
Well, okay. All right. So in relation to children, like again, we're seeing children in daycare, and children play. You could tell them stay in this spot, stay in that spot. Children are going to intermingle.
Yes.
Um, so, so are children getting tested at the same rates as adults right now?
No, I think in general, children have not been tested as much as adults. I think part of that, um, especially earlier on, was you know, many children are asymptomatic. So if they're not having symptoms, they're not, really presenting as somebody who needs to get tested. Um, I think we're doing better now as far as getting kids tested when they need to get tested. Um, but overall, I don't think that kids are tested as much as adults are. And
Okay.
your point about children being social is a good one, and that's absolutely so true. I think kids can do a lot of the things we ask them to do as far as their masks and their hand hygiene, but they are social, so that it's not in their nature to be distant. So that is definitely a challenge.
Yes. Should parents be um, checking temperatures and just really closely monitoring for any change in behavior, symptoms,
Yeah,
anything?
absolutely. One thing that's really important for all of us is to not go to work, to not go to school, to not go to daycare when we're sick at all. So we all need to be really vigilant about watching ourselves and watching our kids for any signs of illness, um, whether that be fever or the runny nose, the cough, the congestion, any of the symptoms we talked about. Um, so absolutely, if there are any symptoms, you need to stay home or keep your child home. Um,
Okay.
but remember, there's so many people who are asymptomatic and who are infected. So we need to watch for symptoms, but that's not going to catch everybody.
Okay. All right. One thing I felt some ask earlier when we were talking about masks is washing them.
Yes.
Um, there are people who keep a hoard of masks in their car.
Yeah.
They have one for every outfit or
Yeah.
whatever. How often should you wash your mask?
Yeah. Great point. Thank you for raising that point. You should wash it every day.
Okay.
Yeah. And if it's not disposable, you should be washing it every day.
All right. So everybody, while you're out there buying those masks to match every outfit, you might just want to double up and have us, keep a stash of clean ones in the car, take the dirty ones in the house and do them with laundry and
There you
just
go.
cycle them out. Now, I do want to ask this though, washing them, um, does it affect the fabric? Does it affect its effectiveness? Like, does it break down the fabric?
Oh,
With
not
clothes, the more you wash them.
yeah. I have, not to my knowledge, I haven't seen any reports of that. But I think, just pay attention. Obviously, if your mask at all looks like it's too worn or frayed or has a hole in it, just don't use that one
Okay.
and get a new one.
Okay. All right. So again, everyone that's on our Facebook Live, if you have any questions, any comments, any parents, and you want to share any testimony, any stories, please feel free to do so. I'm sure as time allows, we will get to it. Or if it's something you want to talk with Dr. Christine about personally, I'm sure she'll be happy to address that and, as time allows. So we want to thank you though for checking in, for watching, for being engaged in the conversation. I know it seems like COVID is the talk It's the conversation piece, like every day, all day. However, we are in a new time and space for us in this generation. And so this is new, like you said, it's brand new for us. Research is still being done. I don't know. I don't know what else to say, like, to get the message across.
Mhm.
Oh, so we're going to take another quick break, but we're going to continue on Facebook Live. So please stay tuned, everyone. If you want to join our conversation, if you have questions, jump on Facebook Live. We'll be happy to get those answered. But we will be back after these announcements with Dr. Kristen Hart, MIT, on the campus of Arkansas State University. I know we're getting tired of the COVID conversation, but until we see some light at the end of the tunnel, we have to keep discussing this, and make people aware. But we'll be right back after these announcements. Okay, so we are off the air. And so I know people are tired. I know they are. And
Mhm.
it's just kind of where we are, though, right now. And it's unfortunate.
Yeah, I think that's another thing that makes this with the holiday season coming up so even harder, right? We've been distanced for months and we're, I think always look forward to this time of the year and now we're saying no, can't even see your family now, and it's just like one more thing on top of all the other difficulties everyone's been dealing with. I think that makes it even harder.
Let me ask you this. I see people, they go, the people that get out, go shopping, they go from one store to another store. And, you don't know if every store is sanitizing their carts and the door handles and all that good stuff. Advise people make a plan for the day and say, okay, what do I really need?
Hmm.
And what store has it? And just go to that one place and go home. Like,
Yeah, I think that's
what
a
would be
good
your
approach.
advice?
Yeah, I think that's a good approach. The fewer places you go, the fewer people you're interacting with, the fewer just things you're touching, I mean, the better off you'll be. So, you know, making a plan is a good idea. Make one big trip to the grocery store every week instead of going in and out several times. Just little things like that are smart right now.
Um, I'm a person that I don't like to go. I know this crazy as a woman. I don't like to. I like to shop online. I don't like to go to multiple stores. So
Online
now
is a
going,
good approach right now, that's for sure.
but I just can't see myself going to Walmart and then Target and then this place and that. I don't know. Maybe I'm becoming paranoid. I don't know, but that's just who I am right now.
Yeah. No, this is the time to be careful, without a doubt.
And I think people need to, I hate to say make, but request that other people are respectful of their space as well. Especially if someone is isolating themselves, don't im- don't bombard their space. Respect them. Saying that, okay, I need my space.
Yeah, I agree. Mhm.
Oh goodness, I know this. We could talk about COVID all day, every day.
Yes, we
Pe-
could.
People are gonna have questions, comments, concerns, frustrations, to say the least. I
Absolutely.
I can't tell you um how many conversations I've seen on just Facebook alone.
Mhm.
People are frustrated.
Yeah, yeah, I agree. People are frustrated. It's understandable.
Oh goodness. When the students come to class, um, do you all take their temperatures, or do you go through any type of measures to, questioning them? Or, they've been around people. Um,
So we have when we enter our building, we have a thing that takes our temperature. But other than that, we don't. like have a daily check off or anything. I
Okay.
think we the students know to not come to class if they're sick at all with any symptoms related to COVID, and then we'll get them tested.
Okay. We're about to go back on air. And
Okay.
this last segment will be a little shorter.
Okay.
So any final comments, wrap up?
You know,
Welcome.
oh, sorry, go ahead.
Welcome back to Community Conversations on KLEK 102.5 FM with my special guest, Dr. Christine Hartford. And during this last segment, I'm just going to give Dr. Christine the floor to give us any final thoughts, any other information we may not have covered. So you have about 5 minutes or so.
Oh, wow. Well, one thing that we didn't touch on that I just want to mention, we've been talking COVID. The flu season is right around the corner. We'll probably be starting to be seeing cases of flu within a few weeks here. So this is the time, this is the year to absolutely get your flu vaccine. We know that COVID is really hard on the lungs, and we know that influenza is really hard on the lungs. And we don't want to have both viruses at once. What that would look like, I don't know, but it certainly is really concerning to me. So please, everyone, anyone over the age of 6 months, unless there's very specific contraindications, should be getting their flu shot. And, in terms of kids and flu, children die every year from influenza. So young people are really at high risk from influenza. Last flu season, 182 children died from flu in the United States. So I'm just going to use this time as a plug and as a reminder for everybody to get your kids their flu shots, get yourself your flu shot, try to protect yourself as much as possible. And, if you think of it on a sort of larger scale, our hospitals are already really, really busy with COVID. And we haven't even gotten into the winter season, which tends to be the busy season for hospitals. So we already have our hospitals stressed because of COVID. And then if you add flu on top of that and all the other things that happen in the winter, that's really, really concerning to me. So let's do everything we possibly can to keep ourselves
Okay.
as healthy as possible.
And one thing I just thought about, you mentioned hospitals, children with pre-existing conditions.
Mhm.
There are children with diabetes. There are children with, different
Yeah.
diseases that adults have to endure. So how does COVID affect children with these pre-existing conditions?
Yeah, that's a good question, and I'm glad you mentioned that. So I had mentioned earlier that there were over 900,000 cases in children. About over 6,000 children have been hospitalized because of COVID, and when the numbers I last saw, 123 children have died from COVID, and it is the children who have underlying medical conditions that do seem to be affected more severely.
Wow.
So those are children with chronic lung disease, obesity, neurologic and developmental problems, cardiovascular conditions, and immune dysfunction. So of all the children that are ending up in the hospital or who have died, it's not exclusively, but primarily the children with more of the underlying medical conditions who are having a harder time.
All right. And so for those that are on the healthier side, would you suggest any vitamin increases, supplement increases, changes in diet, exercise, or anything like that?
Yeah, I don't think there's nothing that I've seen in those terms that are shown to be, that make a difference. I think um, more important are to wear your mask and good hand hygiene and get your flu shot, to be honest
Okay.
with you. As far as exercise, I think that's a good one in terms of just kids' emotional health and a stress reliever, and getting them outside and running around is a great idea.
Okay. And I know most people have backyards, so this is the
Yep.
perfect time to utilize that space. Some some parents have discussed that the lessons that the children are learning are kind of mundane at times, but again, use the opportunity to go outside and use those as teachable moments as well. Make it fun and educational. We have a lady, Brandy, from the local library, who likes to use the word funjucational.
Ah,
Yeah,
I like it.
yes. So take those moments while they're having fun. Still teach them a little something. They're getting exercise. They're learning something. They're releasing emotions and stress or whatever. So yeah. All right. So we have 2 minutes left, Doctor. Are there any final comments you would like to, or advice you would like to give?
I think we covered a lot of good topics. I think for parents, I would just re- encourage them to talk to their kids about COVID and about everything that's going on, because we know that they're hearing about it, and
Okay.
you want to make sure that whatever it is that they're hearing and think they're understanding is correct information, and you just want to touch base with your kids, find out what they are thinking about it, find out what's worrying them, try to help them in any way you can to sort of look at things as positively as they can. So maybe trying to reframe. There's so much negativity that's gone on lately, so much that kids have lost out on. So trying to help them maybe look at something good that's come out of all this, and that can be tough, but whether it's, because they're home and maybe you're working from home, you get to spend more time with each other, or there's a new activity that you've gotten to do together that you wouldn't have otherwise gotten to do. Sometimes helping kids reframe things a little bit,
Okay.
look at things from more of a positive angle can be really helpful to them. Um, but I think really just watching out for any kind of changes in your children and talking to them about this pandemic and about what they're feeling about it is really important.
Okay. Well, I thank you so very much for giving us your time today. Um, I hope that people took away something from this and they start having conversations with their own family unit and they start implementing the things necessary to keep their family safe. So, thank you again, Doctor, and thank you to everyone at NYIT. And I hope to have more of your coworkers here to share more information as we move further into this, and hopefully there's some more research that comes out, and people will have a better understanding of this virus.
Thank you so much for having me this morning.
Thank you, and we hope this won't be our last conversation
Oh,
though.
me neither.
And so thank you everyone out there for listening and watching and supporting KLK. We are your community radio station. Have a great and blessed Friday. All right, so we are off air, and I'm going to stop the live feed here. All right.